Schweitzer.
Thank you, my lady. Lord Stevens, I asked questions on one topic only on behalf of the long COVID groups. In your evidence, you said that solely viewing the amount of COVID through the lens of whether or not there were enough NHS beds was wrong, and the right question, you said, was how you control the numbers of people infected. Linked to that, I wish to explore with you long-term morbidity from COVID-19 infection, which is another metric of harm in the pandemic. NHS England announced the Your COVID Recovery Platform on the 5th of July 2020, which was a platform to support patients suffering from prolonged symptoms after infection from COVID-19. Would it be right to say from this announcement that by July 2020, the NHS were concerned about the prevalence and risk of long COVID?
Yes.
Thank you. Would the NHS have been assisted by a public health messaging campaign on long COVID at this time?
So I think I'd break that question into two parts, if I might. There'd be public messaging for people who might be experiencing what came to be known as long COVID, so that they were able to come forward and engage with services. But perhaps the second part of your question is a different one, which is, would it have made sense for the government to talk about the risks of long COVID as a way of trying to encourage people to take action to limit the spread of the virus? Is that what you're saying?
Yes, it's really about the assistance that will be given to the NHS by messaging coming from the government.
Well, I mean, the root cause of the problem, obviously, is the amount of COVID infection. So I think, you know, there was a clear understanding that less COVID is better.
Yeah, but long COVID comes from COVID infection.
Indeed.
So do you agree that the NHS, therefore, would have been assisted by such a messaging campaign?
Sort of telling people about the existence of long COVID, so people, therefore, were sort of appropriately cautious about their interactions. Is that
yes?
Is that the thought of? Yeah, I mean, but possibly yes. I haven't. I mean, possibly.
In August 2020, NHS England published a detailed briefing note on managing the long-term effects of COVID-19. The paper estimated that a significant number of the UK population will need some form of rehabilitation support for ongoing conditions over the year, and long COVID is described as a new healthcare challenge requiring actions to strengthen NHS services to meet new demand. Do you agree that by August 2020, the NHS were concerned that emerging evidence of longer-term sequelae of COVID-19 would pose an additional cost to the NHS?
Absolutely.
And was the new healthcare challenge and its associated cost communicated and the Cabinet Office?
Well, in as much as we were making public announcements and they would have known we were making the announcements about the NHS services that are being responded, yes, I'm sure they would have been aware.
So assuming that your answer is you agree, how, if at all, did the decision makers respond?
Well, I think the Department of Health and Social Care shared our concern, and I know that senior clinicians, ministers over the summer and into the autumn were also engaging with the question of long COVID and how appropriately to support, and there was a sort of active dialogue between the Department of Health and Social Care and us in the NHS about what that should look like. I can't say what the discussion was between them and the central government, though.
So does that mean you're not able to say how the decision makers, those in number 10 in the Cabinet Office, responded?
That's right.
Thank you very much, Lord Stevens. Thank you, my lady.
Mr. Dale.